So today we'll be talking about intraocular foreign bodies. In our first class on ocular injuries, we have defined what exactly a intraocular foreign body is. It is a type of open globe injury where there is a penetrating injury and there is also a foreign body which is lodged inside the eye. That is what exactly is an intraocular foreign body. There are different types of intraocular foreign body which can be seen. Most of these are occupation related. Now there needs to be a significant force of entry for a foreign body to penetrate the eye wall and lodge itself inside the eye. So the common foreign bodies that we see are iron and steel foreign bodies, glass, stone, lead, copper, plastic and wood. These are the common intraocular foreign bodies which can be seen. Once a foreign body enters the eye, it can be located anywhere from the anterior to the posterior part of the eye. So the different locations include the foreign body can be lodged in the anterior chamber where it usually sinks to the bottom. It can get entangled into the iris. It can also enter the posterior chamber. It can get lodged itself inside the lens. It can go posteriorly through the lens and enter the vitreous cavity, and can also go posteriorly and lodge itself into the retina and choroid. So these are the different locations that a foreign body can be present inside the eye. What are the various reactions that a foreign body inside the eye can cause? It can either be a inorganic foreign body or a organic foreign body. So different inorganic foreign bodies can produce different types of reactions. So glass and plastic foreign bodies, they usually are inert and they do not produce a lot of reaction. Whereas a lead and aluminum foreign bodies bring about a lot of local inflammatory reaction. The pure copper, zinc and nickel foreign bodies bring about a lot of inflammation and infection and a lot of suppuration. That is what we see with these foreign bodies. The specific type of reactions are the ones which are caused by iron foreign body, which is called as siderosis bulbi, and the one with a copper alloy, which is called chalcosis. Now both of these two are important short notes for you. If it is an organic foreign body, what we mostly see is a granulomatous reaction, which is basically a lot of inflammation and inflammatory cells in and around the foreign body. So what is siderosis bulbi? Siderosis bulbi is a degenerative change which is caused about by a iron foreign body, which basically occurs due to the electrolytic dissociation of the iron once the iron foreign body enters the eye. Iron starts to accumulate in the retinal pigment epithelium, the corneal endothelium, the lens epithelium, iris, and also the trabecular meshwork. What are the signs that we see in siderosis? So we see heterochromia iridis. This is because the iron starts to deposit into the iris, as a result of which the iris starts to get a different color. So one iris has got different patterns over there. So one part of the iris will have a little pattern because of the iron deposition. The rest of the iris will be the same. So there will be different colors inside the same iris. So that is what we call as heterochromia iridis. They can be reduced visual acuity because of the inflammation or because of the iron foreign body depositing on the anterior lens capsule. They can also be dark brown deposits on the anterior lens capsule. There can also be some amount of cataract, secondary glaucoma because of its deposition in the trabecular meshwork, and there can also be pigmentary degenerative changes of the retina which are similar to that of retinitis pigmentosa. So these are all the signs that you see in case of siderosis bulbi. What is chalcosis? Chalcosis is a retained intraocular alloy of copper. So here copper starts to deposit in the Descemet's membrane, the vitreous cavity and the internal limiting membrane of the retina. So what are the signs of chalcosis? So the classical KF ring or the Kayser-Fischer's ring is what we see in case of chalcosis. So what is KF ring? Is basically copper deposition in the Descemet's membrane of the cornea. So we usually see it in the close to the limbus, in the periphery of the cornea. There is also greenish deposits on the interlimbic membrane of the retina, and you will also see something called as the sunflower cataract, which is classical of copper deposition in the lens. Sunflower cataract is what we see in chalcosis. So how do we diagnose whether a patient has an intraocular foreign body or not? So first we need to start taking a detailed history. So patient will give a history of injury with a foreign body with a severe impact. So that is very important. Next, we need to examine the patient on a slit lamp. Look for the wound of entry. So there will be a breach in the cornea and the sclera which we need to examine. If the foreign body has passed through the iris, then there will be a foreign body which might be present in the iris, or it can go through it and where we see a small hole in the iris. If it has passed through the lens, then we'll see an opaque tract through the lens, or sometimes it can also cause cataract. The foreign bodies can also be lodged in the angle of anterior chamber, so we can diagnose that with gonioscopy, which is a technique with which we can examine the angle of anterior chamber. And it's also important to do a dilated fundus examination also, because the foreign body can enter posteriorly also and cause severe amount of damage. So these are the various techniques we can use to diagnose a intraocular foreign body. Radiography techniques like X-rays are said to be a little less sensitive. The AP and lateral views are common just to see how deep the foreign body has gone. There was a technique which is called as a limbal ring method, where a metal ring is attached to the limbus and X-rays are taken anteroposterior and lateral just to see how far the foreign body is from the anterior surface of the cornea. This is not used these days because we have much better and sophisticated methods of identifying the intraocular foreign body. Next investigation is the CT scan, which is said to be a highly sensitive modality. Here we are not manipulating the globe, uh, which is done in case of a B scan, which I'll be talking about later. And it can accurately localize any form of intraocular foreign body. So what we see here is a CT scan, and you can see a foreign body right here, and the second picture, a foreign body can be seen here. So this is another important mode of investigation. Here in a CT scan showing a foreign body here in the posterior part of the useful mode of investigation is the B scan ultrasound. It is said to be a highly sensitive method for investigating intraocular foreign body and helps to localize most of the intraocular foreign bodies. Apart from localizing the foreign body, it can also tell you if the foreign body has caused any intraocular damage like a retinal detachment of or a suprachoroidal hemorrhage. So you can see the patient, this is a B scan here, this is the retina, and you can see these spaces here. This is basically blood accumulation. So suprachoroidal hemorrhage is what we see over here. So that is something you can identify with a B scan, which you cannot do with a CT scan. But what are the problems with the B scan? It is very difficult to do in case of open globe injuries. What we do in B scan is we take a probe, put some jelly on top of it, and we run that probe over the closed eye of the patient. So we are putting significant amount of pressure on the eye while doing this investigation, which is not advised. That's why it's very important that we gently manipulate the eye, do a gentle manipulation and not forcefully press the eye, because that procedure itself can cause further damage to the eye. So we have to be very careful, and it requires quite a significant amount of skill to be doing this in case of open globe injuries. But it provides a lot more information when compared to the CT scan. MRI is said to be highly sensitive investigation, but you cannot use it in case of magnetic foreign bodies. It's useful only to detect wooden foreign bodies and some amount of vascular changes.